Dizziness is one of those issues that is extremely bothersome for patients because they get very scared and don't know how to handle it. So simply put, let's first understand what dizziness actually is. There's a difference between dizziness and the feeling that everything is going dark in front of your eyes or that things are getting blurry and you can't see well. And there's a difference between dizziness and losing consciousness. For example, someone might say, I'm dizzy, meaning it feels like the world is spinning around me. I see things spinning around me. I'm the one spinning while everything else is still. That's what dizziness means. Any other definition is just a sensation in the head. Anything else doesn't apply to what we're about to discuss. What are the causes that could be in the ear and lead to dizziness? The causes that lead to dizziness and originate from the ear. There are many causes, including diseases where a person feels they can't hear well with their ears or their ear is ringing sometimes. There are none of these symptoms, meaning there is no problem at all with hearing or ringing in the ear, and yet the cause is still in the ear. For example, there is a condition called positional vertigo, or what people refer to as ear crystals. In this condition, the ear is the reason behind the dizziness, but it does not come with ringing in the ears or hearing loss. This positional vertigo is usually described by the patient as occurring after they've had a bump or made a sudden movement. And when they look to the right or left, or lie down on their right or left side, they experience dizziness. The dizziness is accompanied by vomiting, and it is extremely severe. The world spins intensely, very intensely, and then it stops after a few seconds to a few minutes. This is the simplest type of dizziness. Its treatment is very easy. We perform a certain exercise to confirm that this dizziness is present. The doctor has the patient sit on a bed, moves their head, and checks whether the dizziness occurs or not. If it does occur, the doctor treats it right there while the patient is sitting, and this is considered the simplest type. So, if someone who has never complained of this before suddenly experiences dizziness when moving their head, and it lasts for a few minutes, is intense, and is accompanied by vomiting, they should go to an ENT specialist if this description applies to them, and if the doctor determines that the problem is positional vertigo, he will treat it right there, in the clinic, and God willing, the patient will recover and be fine. But the problem is that this kind of dizziness tends to recur and come back again. So, this is the illness. Apparently, the ear looks healthy, but it is actually the cause of this problem. Is there anything else? Yes, there is another condition, which is when someone catches a cold and the weather is cold. This cold is caused by a virus that enters our body through our mouth or nose and circulates in the body before the cold symptoms appear. At that point, we feel muscle pain and severe fatigue throughout the whole body because the virus is circulating in the blood. If this virus affects the balance nerve, it causes extremely severe dizziness, so severe that patients are brought to the hospital by ambulance. The world spins very intensely. I had a cold 2 or 3 days ago. Everything started spinning for her all of a sudden. This is also caused by inflammation of the balance nerve originating from the ear without any symptoms like hearing loss, tinnitus, or the patient having previously complained about their ear. So how do we recognize it? Just as I told you, the patient usually gives a history of having had a cold or a viral infection with body aches and so on. Then this dizziness happens to them. And the issue usually resolves on its own within a week. The first 3 or 4 days are very intense. We give them sedatives and similar medications to calm the ear and soothe the balance nerve to stop the dizziness. And after a week, they recover completely and there's no problem at all. All right, those are 2 important causes. A third cause, which also isn't related to the ear but is very common, is that the patient complaining of this dizziness might have migraine, also known as migraine headache. In many cases, it comes along with vertigo and severe dizziness. If the dizziness is accompanied by a headache, then in any case, the patient should see a neurologist. But migraine, if someone is a migraine sufferer and knows they have migraines, it's very likely that dizziness can occur along with the migraine. And this dizziness can last for a long time, from 4 hours up to 3 days. The vertigo comes and goes and can persist for an extended period. Now, as for the patient who complains about their ear, for example, if a patient has pus coming from their ear and knows that their eardrum is perforated and then experiences vertigo, of course, this will be diagnosed by an ENT specialist because sometimes infections from the middle ear can spread to the inner ear and cause a very severe vertigo problem. Now, this can also last for days. We need to start treating him quickly because if these microbes entered from the middle ear, which is already infected, and move to the inner ear, they must be treated properly. We could lose hearing, and that's a major problem. So anyone who knows they have an issue with their ear, like pus or a perforated eardrum, if they have dizziness, they should see an ENT specialist first. What about someone without pus or similar issues, but they notice that this dizziness is accompanied by ringing in their ears and hearing loss? There's a very well-known disease. We've talked about it many times before. It's called Ménière's disease. It would be great if you could watch the episodes about it that we've posted on the channel, where it's explained in detail. This is actually one of the common causes that comes with tinnitus in one ear and hearing loss on the same side, and it's usually accompanied by dizziness. This dizziness can last hours or days. Thankfully, treatment is straightforward. Patients usually respond well to it. So that's most of the causes. Most reasons that affect the ear are the ones I've just mentioned. If someone has ear infections or infections spreading from the middle to the inner ear and experiences dizziness, or if someone has ringing in their ear and can't hear well. This is usually Ménière's disease. Sometimes it comes along with hearing loss as well. And if the tinnitus is caused by a tumor on the balance nerve inside the brain, it's not really that dangerous because it's a benign tumor that doesn't grow, and often we just monitor it and don't remove it at all. But while the patient might have some balance issues, but only to a very small degree. Balance problems, but only to a small extent. That's why I didn't want to mention it at the beginning, because people get scared when they hear about tumors. So to recap, we have Ménière's disease, which comes with hearing loss and tinnitus. We have suppurative disease that comes from the ear, and this usually requires treatment by an ENT doctor, or we might have a cold accompanied by the severe vertigo that lasts for a week. There's no need to worry about that. In this case, the problem lies in the balance nerve. There's also inflammation of the balance nerve, or the very common positional vertigo, which happens with head movement, lasts for a few minutes and then stops. This is easy to treat in the clinic, but it can sometimes recur. It leads to loss of consciousness along with dizziness. So basically, if a person who feels dizzy or has vertigo loses consciousness for a moment or collapses without knowing what happened, this points directly to the brain and nerves. The problem is completely unrelated to the ear. There is never an ear problem that causes dizziness along with loss of consciousness. So loss of consciousness is something that should make us look for another cause, away from the nose and ear. I hope I've managed to clarify things about vertigo because it really confuses both patients and doctors alike. If you enjoy these videos, please like them and subscribe to the channel so we know you're waiting for more videos from us. Wishing you all the very best of health.